Hi, we are back with our last segment of Healthy Living, and I have with me Jeanne Goubert. She is an RN with our hospice care for St. Tammany Health System. So welcome.
Thank you.
I'm glad you joined us. So we've been talking about hospice and palliative care because it is National Hospice and Palliative Care Month. So let's talk about what you do for the health system. What's your role?
I am a registered nurse with the hospice department, and I am the admissions coordinator for the hospice department. So any referrals, any consults, they kind of start with me, and then I kind of go through those and make sure the right people are getting them.
So that leads us to what, who needs hospice care? Who's eligible for it?
So hospice care is designed for patients who have a terminal illness with a prognosis of 6 months or less, patients who are no longer seeking aggressive treatment or no longer have options for aggressive treatment, chemotherapy, radiation, patients who maybe are just not wanting to go back and forth to the hospital. You know, that's kind of been their life for the past year or so, and the hospitalizations are becoming more frequent, and that's just not where they want to spend all their time. So any of those patients, you know, would qualify for hospice, pending an evaluation, of course. But those are the patients, those that just want to be home with their family and get back to living the best that they can without all these hospital stays.
Yeah, so I guess that kind of speaks to our next topic. What are kind of the goals? Once someone is in hospice care, what's the goal?
The main goal of hospice is just to provide patients with the best quality of life we possibly can for whatever time they have left, by managing their symptoms, focusing on their social well-being, physical, emotional. It's kind of all-inclusive. We kind of support the patient as a whole and not just the diagnosis. So I would think that the main goal is just to provide them with comfort and let them be with their families.
Yeah, so I often hear people when they talk about hospice, they're like, well, when you go into hospice, you know, you don't get any more treatment, you can't get any more care. So what is the relationship? How does the relationship between one's primary care doctor or oncologist or whatever physician is caring for them in their terminal illness, how does that relationship go hand in hand with your relationship?
So we do actually get that question a lot. We have a full team of staff, hospice staff, one of which is a medical director who kind of oversees all the care of the patients. But if a patient wanted to continue with their primary care physician, just to kind of have them oversee things, they have the right to do that. They don't have to forego their physician. Same thing with oncology or cardiology. They can still have that doctor, but the goals change. You know, you're not seeing the doctor any longer for them to come up with a treatment plan for chemotherapy or diagnostic studies for cardiac disease or whatnot. They're just kind of there to oversee. But we certainly coordinate the care with them and discuss medications and changes and things, maybe medications they've used in the past that didn't work, and we can communicate that back and forth with the team that they are current with. But just the focus and the goals change from aggressive treatments, curative treatments, to just more palliative and comfort.
Yeah, so we talk about hospice care. Where does it occur? Because I know that it can occur in your home, and we also have an inpatient hospice option for people. So kind of talk about what's the difference.
Yeah, so primarily the goal is always to have your patient or have the patient at home. That's always the goal, if that's feasible for the family. Ideally, of course, we want them home surrounded by their family, their loved ones. We just want it to be as peaceful as it can be for them. So home, if they have a caregiver, if they have family support that can provide that in the home with the assistance of the hospice team, that would be our first choice for the patient. Nursing homes, if you are not able to provide in-home care, because caregivers are still part of the process.
Right.
So if you don't have a caregiver that can physically provide the care, we can do this in a nursing home, and we coordinate with the nursing home facility. And then we do have inpatient hospice. That is done at the hospital, at St. Tammany Hospital for us, and that is more for our complex symptom management.
Gotcha.
So inpatient hospice is designed for those patients who require more than we can provide for them at home. It may be increased oxygen requirements that we just cannot get in the home. It may be IV medications because the oral medications were tried and didn't help. But those are the patients that qualify for inpatient, you know, which is a great option because it just kind of eases the idea that what if I can't do this? What if they get into a crisis at home? We always have an alternative. We can always get them to the hospital. They remain on hospice and we can provide the care for them there.
So how would someone know, I guess, how do you know when you should recommend to your loved one hospice care, or when you, the patient, is ready for hospice care? What are the tipping points for that discussion?
I guess I would say first, if you have any disease process that is a progressive type disease, Alzheimer's, you know, cardiac disease, cancer, of course, if at any there's no wrong time to ask about hospice. There's no wrong time to receive the information. But we do get asked, how do I know? What are the signs? I would say if you are a patient who just does not want to go back and forth to the hospital, your stays, your hospitalizations are becoming more frequent. You know, you're spending more time in the hospital than out of the hospital.
Right.
If you know, it used to be once a year you go to the hospital, now you're going once every 3 months. That's probably the time to start at least getting the information about hospice. And we send nurses out to the house to do informational visits all the time. We schedule that when coordinated with families so that daughters, cousins, aunts, uncles, whoever wants to be present can be present. We send a nurse out to the house to give that information, and if there's no charge for that, so if you're not ready in that moment, at least if in a month something happens, you know, you already have that information. But I guess I would just kind of, you know, if you're just not wanting to go back to the hospital, you're no longer wanting to pursue treatments and tests and surgeries and things of that nature, then I think it's probably worth a consideration.
Right. So much like Stephanie, I would imagine that you also establish wonderful relationships with the families that you support. And so I guess I want to ask you too, why did you choose hospice care?
I think, you know, I did hospital nursing for many years, and I think it's just so fast-paced. It's just task-oriented, and hospice allows you an opportunity. Number one, you see the patient as a patient, and you're not just concerned about a diagnosis. You get to see them in their own environment. You get to see them as a mom, as a dad, as a brother, and it just, you know, you develop these bonds with these patients, and then it's one of these parts of it's part of life that you know, I think often gets kind of forgotten, and people at the end just don't know what to do. And I just think it's an honor that we get to be there with them and kind of help them on their journey and make sure that they get to pass with dignity and respect that they deserve. So
that's amazing. Well, thank you for what you do. And I talked to Stephanie about this also, the Angels of Light ceremony, a tradition, and this year's event is really special because we are honoring someone who was a part of St. Tammany Health System for about 44 years.
Yes.
So do you want to talk about that part?
By the Angels of Light?
Yeah, and who it's dedicated to this year.
So it's in honor of James Corr, who was a board member with St. Tammany Health Systems, and that event is December 5th at 5:30. It takes place in the hospital lobby. The Angels it's for a donation. $15 can be purchased at the gift shop, the foundation. And it's just a great way to honor our loved ones, you know, who have either passed or maybe fighting a battle now, and just, you know, be able to begin the holiday season in such a way to kind of all come together. People who are in the same similar situation, maybe grieving like you know, and so that you're not feeling alone in the beginning of the holiday season. So I think it's one of the most beautiful ceremonies that we do. So
I agree. I love it. So, is there anything else you want to add about this topic or anything else we talked about today?
No, just, you know, phone call away. If you're ever in doubt, if you're not sure if now is the right time, it's no harm in calling. You'll likely get me when you call. I'm typically the first person that families talk to, and I'm happy to give any information.
Wonderful. Well, thank you so much for being here, Jeanne. I appreciate your time. And that is going to do it for this episode of Healthy Living. We'll see you next time.